Semaglutide is a glucagon-like peptide 1 receptor agonist developed initially for type 2 diabetes that has demonstrated significant weight loss effects in clinical trials. This led to its FDA approval for chronic weight loss management in patients with obesity or overweight with at least one weight-related comorbidity. Hello, this is Dr. J. Park for medicalweightlasstraining.com. Understanding glucagon and GLP-1. Glucagon and glucagon-like peptide 1, GLP-1, are two peptide hormones that regulate glucose homeostasis. Glucagon, a 29 amino acid hormone, is secreted by the alpha cell of the pancreatic islets in response to low blood glucose levels. It raises blood glucose levels by stimulating glycogenolysis and gluconeogenesis in the liver. Also, glucagon promotes lipolysis in adipose tissue, providing free fatty acids as an alternative energy source during periods of low glucose availability. Since insulin promotes glucose uptake and storage, glucagon is a counter-regulatory hormone. GLP-1, a 30 amino acid hormone, is secreted by the L cells of the gastrointestinal tract in response to food intake. GLP-1 helps in glucose homeostasis by enhancing glucose-dependent insulin secretion from the pancreatic beta cells, inhibiting glucagon secretion and delaying gastric emptying. These actions result in reduced postprandial glycemia and improved overall glycemic control. GLP-1 also has central effects on regulation of appetite and body weight, as it acts on the hypothalamus to promote satiety and reduce food intake. Semaglutide is a glucagon-like peptide 1 receptor agonist initially FDA approved for the treatment of type 2 diabetes. In clinical trials, it has demonstrated significant weight loss effects, leading to its FDA approval for the following indication and usage. Wegovy is a glucagon-like peptide 1 receptor agonist indicated as an adjunct to a reduced calorie diet and increased physical activity for chronic weight management in the following: adult patients with an initial body mass index of 30 kilograms per meter squared or greater, or 27 kilograms per meter squared or greater in the presence of at least one weight-related comorbid condition. Pediatric patients aged 12 years and older with an initial BMI at the 95th percentile or greater for age and sex. The mechanism of action of semaglutide mimics the effects of the native hormone GLP-1, which is released in response to food intake. By binding to the GLP-1 receptors in the brain, semaglutide reduces appetite and food intake. Additionally, semaglutide slows gastric emptying and improves insulin secretion, which improves glycemic control. The efficacy of semaglutide as a weight loss treatment option has been demonstrated in several clinical trials, including the SUSTAIN, Semaglutide Unabated Sustainability in Treatment of Type 2 Diabetes, and PIONEER, Peptide Innovation for Early Diabetes Treatment, Trials for Type 2 Diabetes, as well as the STEP, Semaglutide Treatment Effect in People with Obesity trials, which specifically focused on weight loss. These trials showed weight reduction and improved glycemic control. Semaglutide has the FDA approval for two indications: type 2 diabetes and chronic weight management in adults with obesity. Semaglutide Ozempic was first approved by the FDA in December 2017 as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus. It is a once-weekly subcutaneous injection at doses of 0.5 milligrams or 1 milligram. In June 2021, the FDA approved semaglutide, or Wegovy, at a higher dose of 2.4 milligrams for chronic weight management in adults with obesity or overweight with at least one weight-related comorbidity such as type 2 diabetes, hypertension, or dyslipidemia. There are several other glucagon-like peptide-1 receptor agonists approved by the FDA for the treatment of type 2 diabetes. They include the following: lixisenatide. Pros include the following: improves glycemic control associated with weight loss. Cons include the following: relatively modest hemoglobin A1C reduction compared to other GLP-1 receptor agonists. Zenatide. The pros of zenatide include the following: improved glycemic control, promotes weight loss, and twice daily or once weekly dosing options. Cons include the following: higher incidence of gastrointestinal side effects compared to other GLP-1 receptor agonists. Liraglutide. The pros include the following: effective in improving glycemic control, associated with weight loss, and reduces risk of cardiovascular events. The cons include the following: potential increased risk of pancreatitis and thyroid C tumors. Dulaglutide. The pros include the following: effective in improving glycemic control, promotes weight loss. Cons include the following: possible risk of pancreatitis and thyroid C tumors. Semaglutide is a glucagon-like peptide-1 receptor agonist that mimics the effects of GLP-1, a hormone that regulates glucose homeostasis, appetite, and energy balance. Semaglutide has a 94% amino acid sequence homology with endogenous GLP-1. It has an extended half-life, 1 week, due to its structural modifications, allowing for once-weekly subcutaneous administration. The mechanism of action of semaglutide includes the following: 1. Enhanced glucose-dependent insulin secretion. Glucose-dependent stimulated insulin release from pancreatic beta cells, which improves glycemic control. 2. Suppress glucagon secretion. Inhibits glucagon release from pancreatic alpha cells, which reduces hepatic glucose production, which improves glycemic control. 3. Delay gastric emptying. Slows gastric emptying, which helps in reduce postprandial glucose excursion, which is the change in glucose concentration from before to after a meal, and promotes satiety. 4. Reduce appetite and caloric intake. It acts on the central nervous systems to regulate appetite. Clinical trial outcomes and safety profile. SUSTAIN, PIONEER, and STEPS are the 3 major clinical trials for the efficacy of semaglutide in type 2 diabetes and weight loss. The SUSTAIN, which stands for Semaglutide Unabated Sustainability in Treatment of Type 2 Diabetes, trials were a series of global randomized controlled clinical trials that investigated the efficacy and safety of semaglutide in patients with type 2 diabetes. The trial included 3,297 patients with type 2 diabetes and a high cardiovascular risk who were randomized to receive either semaglutide 0.5 mg or 1 mg subcutaneously once weekly or placebo. SUSTAIN 6 demonstrated a significant reduction in hemoglobin A1C levels and body weight compared to placebo, along with the reduction in cardiovascular risk. The results were the following: the primary outcome, composite of cardiovascular death, non-fatal myocardial infarction, or non-fatal strokes, occurred in 6.6 patients in the semaglutide group and 8.9 patients in the placebo group, indicating a 26% lower risk with semaglutide. Semaglutide led also to a significant reduction in hemoglobin A1C compared to the placebo. Patients receiving semaglutide experienced significant weight loss compared to those on placebo. The PIONEER trial, stands for Peptide Innovation for Early Diabetes Treatment, were a series of global randomized controlled clinical trials that investigated the efficacy, safety, and tolerability of oral semaglutide. The trial included 3,183 patients with type 2 diabetes and established cardiovascular disease, chronic kidney disease, or both, who were randomized to receive either oral semaglutide, 14 milligrams, once daily, or placebo. Pioneer 6 showed that oral semaglutide significantly reduced hemoglobin A1C levels and body weight and was non-inferior to placebo in terms of safety. The results were as followed. Oral semaglutide reduced hemoglobin A1C levels compared to placebo. Oral semaglutide patients experienced significant weight loss compared to those on placebo. STEP trials stands for semaglutide treatment effect in people with obesity, were trials evaluated for the weight management of individuals with obesity. It was also a global randomized controlled clinical trials that investigated the efficacy and safety of subcutaneous semaglutide in individuals with obesity or overweight with diabetes. A total of 1,961 adult participants with a BMI of at least 30 or at least 27 with at least one weight-related comorbidity were randomized to receive either semaglutide 2.4 milligrams or placebo administered subcutaneously once weekly along with lifestyle intervention. Step 1 demonstrated that semaglutide led to a significant reduction in weight loss compared to placebo, with a mean weight loss of 14.9% in the semaglutide group. The results were as followed. The primary endpoint was the change in body weight from baseline to week 68. The patients in the semaglutide group experienced a mean weight loss of 14.9% compared to the 2.4% in the placebo group. Participants in the semaglutide group achieved a weight loss of at least 5%, 10%, or 15%, and improvement in secondary endpoints such as waist circumference, blood pressure, lipid level compared to the placebo group. Thank you for listening and watching our semaglutide medical weight loss training for clinicians. If you would like to learn about the semaglutide treatment protocol implementation, then go to medicalweightlosstraining.com and sign up for the online medical weight loss training course. This is Dr. J. Park. Thank you very much.